Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everybody, and welcome to episode number 31 of the Better Health Guy blogcast series. Today's guest is nurse practitioner Amy Joy Smith, and the topic of the show is PANDAS and PANS. Amy Joy Smith is a nurse practitioner specializing in functional medicine in Northern California. Amy is a renowned pioneer on the PANDAS front and also the mother of an amazing child with PANDAS. She is a dedicated PANDAS awareness advocate and serves on the pandasnetwork.org board of directors. Amy has practiced functional and nutritional medicine since the early 1980s and has studied with a number of pioneers in the field. She attended Syracuse University School of Nursing, where she received her BSN in Maternal-Child Nursing and all of her acute care and hospital experience in pediatrics. She was a fellow in the World Health Organization's renowned Adolescent Health Training Program in the University of Minnesota Medical School, and in addition to being a nurse practitioner, has a master's degree in adolescent health with a focus on youth development and community health from the University of Minnesota. She was featured in the recent documentary My Kid Is Not Crazy, which is a powerful film exploring the impact of PANDAS and PANS on the lives of those that it affects. And now, my interview with Amy Joy Smith. PANDAS is pediatric autoimmune neuropsychiatric disorder associated with streptococcal infections, and PANS, which is pediatric acute neuropsychiatric syndrome, is a condition that significantly impacts the lives of those that are dealing with it. It is an honor for me today to have Amy Joy Smith on the show to educate us about this topic. Thank you so much for being here.
Thank you so much for inviting me. I love talking about PANDAS and PANS.
I know you do. I've been at some of your previous lectures and I learned so much each time, and it's really frustrating for me to see the struggles that these kids and families go through when it's still not widely accepted. I mean, it's just heartbreaking.
Yes, it really is. And fortunately, I feel like with the most recent literature and publications and information that's coming out, that there might be some turning of the tide in terms of its acceptance. And I'd be happy to, talk about that. But I'm very grateful that that is hopefully the case.
Yeah, absolutely. So tell us a little about your experience and your family's experience with PANDAS and how that then led you to doing the work you're doing today with so many children.
Sure. So July 7th, 2006, was the first day that my son developed symptoms that it took 3.5 years to find out what it was from. And it was pretty nightmarish during that period of time. And even afterwards, it took another 3 years to really get him well, because I was first teasing out all the parts of PANDAS and the components and, what actually can lead up to somebody's immune system breaking down like that. And then I think once somebody's had it for a really long time, there's also the ripple effect of how it begins to affect other pieces. Whereas if you catch it right away, you don't have to do quite that much cleaning up. So during that period of time, we had just moved to Sonoma County. We were living in Atlanta before that. And it started July 7th. So that was the day that the moving company was loading up our furniture. And he started saying, my ankle is bugging me. My ankle is bugging me. Then it was another body part and another body part. And we just figured it was, he was always kind of an intense little guy. And maybe we were moving across the country. He was 10. And we were just pretty much dismissive of it. And then the next over the next 10 days, he and I were driving across the country. We brought our bikes. We were going to explore the desert and have a lot of fun. But by the time we were driving across Salt Lake City area, I just remember driving like a maniac. I had two hands on the wheel and my foot was just on the pedal because he was laying in the back seat with a towel over his head, crying because he was having these movements. And then all of a sudden he had to count everything. He had to count the light posts on the highway and the spaces. And that's all he could do. And our very, very, very first stop, as soon as I got to Sonoma County, I took him right to Kaiser emergency room. I said, something happened to my child. And they started talking to me about my autistic child. I said, he was not anything like this 2 weeks ago. They thought I was either out to lunch, they couldn't understand how I could possibly be saying that he was not like that 2 weeks ago. And instead of it triggering a thought like, wow, maybe he has a tumor, what if he's poisoned or toxic? Maybe he's got meningitis or encephalitis from a virus. They never asked me one question about any physical symptom or issue. And they just said it's anxiety, and they gave me some Ativan. And that was that.
Wow. That's got to be frightening as a parent.
It was like entering into a completely different world. I mean, I'm a medical professional, and they were thinking I was, I don't know, out to lunch or something.
Well, as difficult as your journey and your son's journey has been, the good thing that's come out of it is that you've been able to help lots of other children and lots of other families and bring lots of awareness. So it certainly seems to me that this is part of the universe's purpose for you to be able to help so many other people.
Believe me, I get it. I do.
So tell me a little bit about what is PANDAS and what are some of the primary symptoms? How does the condition impact the child's life?
PANDAS is a misdirected immune response. And what ends up happening is somebody gets strep throat, and they may or may not ever know it. It might have been a transient illness that no one thought to get tested for. It might have actually been strep, and it might have even just been a stomach ache that completely went underneath the radar. And then because of some pre-existing genetic susceptibility of some kind or whatever, we don't totally know all of what those things are, even though I do try to identify any immune issues that child is having in case there is an open door somehow. But the strep strain is a very special kind of a virulent strain called a rheumatic strain of strep. And what that means is that the strep itself looks like its host, looks like our tissue. And so it tricks the immune system into attacking the tissue instead of the strep. And that's how the strep survives. And it's amazing. And we've known about rheumatic fever for hundreds of years, right? Rheumatic heart disease, kidney disease, joint disease. And PANDAS is when the rheumatic fever strikes the brain.
So this is a molecular mimicry of the strep so that it looks like your own tissue, and then the immune system, maybe in trying to do the right thing by responding to the microbe, then ends up impacting the brain or creating essentially some type of an autoimmune response.
Absolutely.
Okay.
The immune system attacks the brain thinking that it's really an invading microorganism. And so the strep, can persist hidden in other tissues. And it's an autoimmune reaction, and it creates brain inflammation.
So what are some of the key symptoms that one might observe in a child that's dealing with PANDAS, particularly when they're going through a flare?
Well, especially in the very beginning. It is an acute, usually overnight, alteration in that child's psychological, emotional, or behavioral well-being. Something radically happens. Very often a parent will say to me, I dropped my kid off at school and it was a regular day and I picked them up and it was like a different child, or my child woke up like a different child, or something happened that maybe upset that kid the same way they might get upset, but it turned into a huge change in the way that they were dealing with it and how big it got and their capacity to manage themselves around it. That was very atypical for that child.
Wow. So how many children do we think are impacted by PANDAS or PANS? And is it increasing, or is it just that we now have more awareness and people are more educated about how to identify the condition?
We don't know the answer exactly because we haven't been counting long enough. And in fact, there isn't even a database or a registry at this point, and that is something that we're working on developing. But we're thinking about 1 in 200 children have PANDAS or PANS, which is really a lot of children. It's over 375,000 children in the United States.
So when someone is diagnosed with PANDAS or PANS, does it tend to be more of an acute condition that resolves, or is it more in line with a chronic illness or chronic condition that needs to be managed and monitored over a long period of time?
Well, the answer to that question could take us the entire, our entire dialogue, because the answer is it really depends. It depends on how quickly that child is diagnosed, for one thing. And most of the time, they are misdiagnosed as either a psychiatric problem, an emotional or behavioral or parenting problem. And so they can end up on psych meds for months or even years, or behavior modification routines or disciplinary routines. And that is going to stall how long it takes to get that child diagnosed. And they will have this persistent brain inflammation in the meantime. And so it can become more difficult. But kids that are diagnosed pretty quickly, they can absolutely just resolve and move on. And I have children that have been very, very little that I treated them and I haven't heard back from them, even though it's only been a few years, right? Because we haven't been treating all that long. And I also have some, older kids like that who came to me at 19 and 21. And we dealt with it and we did IVIG, and they're off living life and kind of everything in between. I think also a lot of these kids have some other immune disruptive issues or a lot of different infections, because when the immune response isn't working properly, what ends up happening for these kids is that it's kind of like the wiring of how the immune response takes care of its business gets messed up. So for these kids, instead of the immune system detecting an invader, doing its beautiful little dance and getting rid of the invader, what happens with these children is that they have this misdirected immune response. So it detects an invader and creates brain inflammation instead of getting rid of the invader. So a lot of these kids are loaded with infections. And I think that's an important issue in terms of when a child is having persistent PANDAS symptoms after going through standard treatment of antibiotics, anti-inflammatories, and IVIG. If they're not better, I think that something's being missed in terms of like infections that are continuing to drive that broken immune response. So that would be another reason why kids don't get better quicker.
So you mentioned in your son the driving on the highway and counting every so often counting and repetitive type behaviors and things. What are some of the other key behavioral things that kids with PANDAS or PANS often present with?
The biggest things that they're going to present with are OCD almost always, but not always. And it could be just a little bit. It could be obvious. It might not even be obvious to somebody, a parent. It might just be asking a bunch of questions over and over, or things that might not even be in their radar immediately. Tics. Tic disorder, body movements, actual choreiform movements that they don't have control of. And also a sudden onset of like food problem, food aversion, and or anorexia. Not always related to the standard anorexia types of things, afraid I'm fat, but it could be a fear of swallowing or fear of choking or afraid all of a sudden they're going to throw up, or something with the texture, or everything has to be pink food, or, something really off and unusual. So there has to be at least one of those three.
Yeah, go ahead.
Okay. And then there are, other groups of symptoms that usually you will see that comes along with it. Number one is behavioral regression, separation anxiety, a child that was maybe 8 years old and doing certain things, dressing themselves a certain way, handwriting a certain way, riding a bike a certain way, all of a sudden is acting much younger, or loses a developmental skill, or starts bedwetting. And I think it was Sue Sweeto, who is the person at the National Institutes of Mental Health that kind of originally figured out about PANDAS, that it's a thing, had a thought that if a child has a sudden onset of OCD, separation anxiety, where they cannot leave the side of a parent, and bedwetting, new onset of bedwetting, you can bet everything you have that it's going to be PANDAS. It's a very unusual combination of stuff.
Wow. Yeah. And what we'll talk a little bit about the documentary, but one of the things that I had taken away from the documentary was that the kids, especially those that have maybe had beyond just their initial kind of presentation, have been maybe re-exposed to strep or some other trigger that caused the symptoms to flare again, is that oftentimes they went from the most loving, calm children to not being able to really control their emotions and potentially being more aggressive. It was such a striking difference in a very short period of time, just in the child's personality.
These children, that you have to realize is that their brain is really inflamed. I mean, it's encephalitis in its fullest capacity. There's a part of the brain called the basal ganglia that becomes highly inflamed. And so it's like having your brain on fire. And if anybody else was experiencing that, we would also have a completely radical shift in how we were capable of functioning because of our brain being completely on fire. And it makes me think about this book called Brain on Fire by a wonderful writer, Susanna Cahalan, who I highly recommend this book. You can literally read it in one day. And it's this story about her. She calls it her day of madness, or her year of madness. And what happens to her is also the development of an autoimmune encephalitis, even though the mechanism is a little bit different. But here is this beautiful, successful 24-year-old. She's a writer for the New York Post, happily living in New York. And all of a sudden, she develops this brain inflammation, and her whole life falls apart. Her responses to people fall apart. People think she's crazy. She loses her job. It takes months to figure out what's going on with her. Everyone says the same thing. You need psych meds. This is anxiety. She's like, I don't really think this is anxiety, but okay. I mean, she tries everything. And then it's discovered that she has this also molecular mimicry, autoimmune encephalitis that got triggered. And in fact, the treatment is similar. It's immune modulation and reducing the inflammation, right?
Very interesting, very interesting.
I know.
So at what age does PANDAS most commonly present, and is there a difference in the rate of boys versus girls? And then we've talked about it some, but it sounds like the onset is generally or always very abrupt. But are there those cases where maybe it comes on over a period of time and is not quite as abrupt?
Okay, so the most common age seems to be, at least in terms of what we know so far, right? Because we only see a small percent of the children that actually have PANDAS. So of the children that we see, the most common age is 4 to 7 or 8 years old. But there are younger children, like from 1 to 3 years old, whose parents really report very significant sudden changes. How are you going to identify a little thing like that? Most of the time we're told they're on the autism spectrum, right? So it's kind of hard to quantify that. And then there are also 1% of the cases based on a survey of 700 families that was done through the University of Buffalo. SUNY Buffalo just came out earlier this year. 1% of the kids with PANDAS were over 14 years old. I see more than that in my practice. It could just be the awareness of everything, is actually changing. And there are more boys than girls, 3 to 1.
Very
I don't know
interesting.
why.
Mm-hmm. Yeah, that's interesting. And that's also true of many other conditions, including autism, that there's definitely more boys than girls. And it's interesting. I know there that the testosterone potentially, combined with mercury and other things has been discussed. But it is interesting because a lot of autoimmune conditions, when you look at adults, tend to be more predominant in ladies versus men, right? So it's kind of the opposite. So as
I wanted to answer one other thing that you asked. I didn't quite get to it.
Yep.
You asked about whether the onset could ever be something other than acute. And if it's really PANDAS, the answer is not really. However, there's some caveats with that make it more difficult. It could be an acute onset that nobody knows what it is. The child is acting completely unreasonably. Nobody knows why. In the first onset, and even the second onset, and for some lucky kids, depending on their diet and so on, maybe even the third onset, the symptoms may self-resolve, right? The strep comes, the strep goes. The blood-brain barrier breaks open, the inflammation happens, the antibodies attack the brain, and then over a period of maybe 4 to 6 weeks, maybe by 8 weeks, the antibody levels decline and the kid goes back to their baseline. And so you may never know what that was. Okay, then they just go on. They're like, oh, well, that must have been a developmental stage, or we moved, or, oh, it must have been stress from blah, blah, blah. They just don't know what that is. And so then maybe a year later or 2 years later, 6 months, whatever it is, it happens again.
So there is always, it sounds like, or almost always an abrupt onset. It's just that it may not be identified.
Absolutely. Yeah. And then after a child has had a couple of those instances of brain inflammation, and certainly by the time they have 3 or 4, instead of a full recovery, they may recover but not get all the way back to their baseline because there's this low-level persistent inflammatory state. So that over time, if someone's undiagnosed, their behavioral baseline changes. The overall trajectory of that child's life and well-being changes. And so if that goes on for years, that parent could completely lose track of that. They kind of remember they were different, but now they're just dealing with a problem child. So it can get missed is really my point.
Right.
But with a good medical history, you will find it if you go methodically through that child's history, and it's imperative to do that.
Absolutely makes a lot of sense. So as I understand it, PANDAS is when strep is the trigger, but then more recently we talk about PANS, which is a similar presentation, but kind of broadens the scope of the potential triggers. So can you talk to us a little bit about other triggers beyond strep that can present with the same type of condition that we're talking about here?
Absolutely. So PANS is like this overarching condition, right? PANS is pediatric acute neuropsychiatric syndrome. So a child presents with a significant manifestation of a change in their neuropsychiatric functioning. Okay. And then you try to figure out why. Well, there can be infectious triggers and there can be non-infectious triggers. So for example, maybe that kid is a little thing and was in the garage and got into the cleaning stuff and ate turpentine or rat poison, which is arsenic, right? Or was out in a field where they just sprayed some kind of pesticide. So there's environmental triggers. Maybe that child is really mold susceptible. And what you're seeing is an onset of like mycotoxin issues, right? That's affecting his brain and nervous system. That's also an environmental trigger. Or maybe that child has some inborn error of metabolism and their enzymes or something is really, really funky. Or maybe they have diabetes or lupus, cerebritis, right? All of those are internal conditions that can cause that total change in the way that child is working. So those are non-infectious triggers. And then you've got infectious triggers. So if the infectious trigger is strep, then it's PANDAS, right? But there can be other infectious triggers. For example, if that child, you don't know, was bit by a tick or a mosquito that had Lyme or Bartonella or Babesia, you don't need an autoimmune reaction with those kinds of bacteria that directly infect the nervous system to see a radical change in a child's behavior. Or some viruses, Epstein-Barr, CMV, Coxsackie, there's a bunch of them out there, can cause encephalitis all by themselves, right? So the point is there's a host of triggers that should be looked at rather than just saying, oh, kid has a psych problem.
How often would you say that strep is identified as an underlying trigger versus all of those other things that we just talked about?
You know, I don't think we have data like that, but I will tell you of the kids that I see, and I don't know that it's a good snapshot of typical PANDAS children because I'm an integrated provider and I also treat Lyme, and so sometimes people that tend to have more complex stuff come to see me. Yeah. So it's not really a great reflection, but of the kids that I see, I would say maybe, let's see, pure strep, not Lyme, is a small percent.
Wow.
Maybe 25%. Pure strep, no Lyme, no mycoplasma, no other things except maybe gluten or something, right? Just pure strep, no other bugs.
So it sounds like it's pretty important that we've expanded the definition of this condition over time to consider all those other things, because maybe people presented with a PANDAS-like condition, but it was never really figured out because people weren't thinking about all those other triggers that you just mentioned.
Absolutely. And I think that's part of what happens, you know, is that somebody might even say, wow, this really sounds like PANDAS. But either maybe they don't know fully how to work it up, or maybe that child is somebody that does not produce the blood titers to group A strep, even if they have it. And part of the reason is not even necessarily that person, but those titers, those blood test titers are like a half a century old. And they reflect the strep of that time, right? They look for antibodies to certain strep proteins in group A strep, but not all group A strep today makes those proteins. The bug is evolving all the time, and we don't have really state-of-the-art ways of testing for strep titers. So it could be a completely false negative, very similar to how you get false negatives with Lyme, right? So because of that, it's called a clinical diagnosis. You know, if it looks like PANDAS, you know, and it sounds like PANDAS, and there are, you know, enough of the requirements for the different types of symptom groups, you know, related to PANDAS, and the onset is similar, then you try to treat it that way.
I have understood about PANDAS as well as that it may be that the trigger, the strep, the bug that initiated that immune reaction could actually be gone by the time the person is seeking out some type of medical care. And so is that the case, that the strep may have come, triggered the reaction, and is long gone by the time they come to see you?
More than likely, that is the case. And especially if it's strep in the throat or strep in the nose, those may be long gone. And that is why it's called a post-infectious syndrome, especially the first time.
How long would you say that it takes for the average family to get a diagnosis of PANDAS for their child? And why is it that diagnosing it today, when it seems like it's becoming fairly well characterized, why is it still so difficult to get a diagnosis?
I think that anything new, first of all, it takes a long time before it filters its way through all the layers of the medical system, or probably any system, you know, new information. Plus, there were some years where there was a controversy around PANDAS, where everything was presented, data were presented, and a couple of neurologists felt that it was unlikely that there could be PANDAS, and it just became a huge just discrepancy and a problem and a controversy. And people tend to stay away, you know, from controversies and say, oh, you know, there's no such thing as PANDAS, or just kind of sit back and wait and let the data flush itself out over time. So that really slowed down, you know, the progression. But in terms of how quickly people are diagnosed, we don't have data within the last probably year. But before that, we did a survey at a PANDAS symposium that we had out here. And at that time, about a third of kids with PANDAS, that was 31%, took 3 years or longer. And that was down from 37% a couple of years earlier. So, you know, we were hoping that that is a trend. And then the other major group, I mean, there's a lot of little groups, but the other major group was how many children were diagnosed in 6 months or less. I mean, it's still a really big period of time. But, you know, that was also up from, you know, about 21% to maybe 27%. So I think if we looked now, based on the data that we have now, you would see that number going up. And I most certainly see that in my practice. I have providers that call me at least twice a week and say, I think I have a kid with PANDAS, what do I do? That's amazing.
It sounds like PANDAS and PANS, it's kind of a very similar situation that maybe Lyme was in a few years ago around the controversy, similar to what happens with a lot of people that have, something like Morgellons, where they're told, oh, it's just psychological because people don't really understand it. So I'm pretty confident that this is going to, ultimately people will accept and acknowledge this as an actual condition that has a true underlying cause. And thank goodness there's people like you out there now that are already helping these kids and these families, even in the midst of still some controversy. You mentioned from a testing perspective that you can do some antibody testing for strep. What other types of tests do you do? And then maybe you can tell us a little bit about the Cunningham panel, and then what does that tell you as a clinician?
The Cunningham panel is great. It is done at molecular labs at the University of Oklahoma. And Dr. Madeline Cunningham has been studying strep for decades, and she's specifically been studying rheumatic heart disease and the antibodies associated with rheumatic heart disease. And what I mean by antibodies is which antibodies am I creating against my heart, right? So they're auto antibodies. And so she had the wherewithal to explore whether there were auto antibodies being produced in PANDAS. And in fact, Sue Sweeto, early on, when she said, hey, I think I'm seeing this, contacted Dr. Cunningham and said, can you please take a look and see if you can find any of these auto antibodies? And so she did find 4 antibodies, 2 against 2 different dopamine receptor proteins, antibodies against 2 other proteins, tubulin and lysoganglioside, that are widespread all throughout the nervous system, right? These are proteins that make up nerves and brain tissue and so on. And so in PANDAS, acute PANDAS especially, of course, you will see that the body is making antibodies that attack those brain proteins. So that's one big chunk of the test. And then there's another test on there, which is a protein, kind of like an enzyme called CAM kinase 2. And I think the best way to think about that is that the higher the number, the greater the breakdown of the signaling through the blood-brain barrier.
Yeah, so it's very interesting. And one of the questions that I had about the Cunningham panel is I've also seen some adults that have done the Cunningham panel. They had some abnormalities. And so the question is, does that then mean that they potentially had PANDAS or PANS, or could that be an adult that had a mold exposure, that we're just seeing some of those same things, even though maybe they don't present in quite the same way as the children with true PANDAS or PANS?
Yeah, I think that exact question is something that Madeline is looking at, Dr. Cunningham, but the lysoganglioside, for example, is very reflective of strep. It's very reflective of Sydenham's chorea and choreiform disorders, movement disorders that are associated with strep. So, it's a little bit vague, right. But I think too that sometimes strep is the priming incident. It's the thing that sets this misdirected immune response in motion. Even though, I guess it also can be mold and some of, those other kinds of triggers.
Very interesting. So let's move a little bit more into how you approach treatment. And so we talked about brain on fire. We know that there's a big inflammatory issue in these kids. And so what are some of the tools that you use to really help to control the inflammation and put out that brain on fire that really leads to a lot of the symptoms?
So, my basic algorithm for treating PANDAS is just to always remember that it's immune-triggered brain inflammation, right, due to a misdirected immune response. Like, those are kind of the three main things that I go back to. So, immune triggering. First, I really try to identify and treat or remove whatever big immune triggering that child is having that we can even test for, right? I mean, there's always things that we can never test for. But, is there strep, Lyme viruses, mycoplasma, mold, toxic environments, gluten issues, gut-based infections, parasites, those kinds of things I pretty aggressively look for and try to treat or remove to the best of my ability. All the while looking to reduce inflammation. So interesting with PANDAS, ibuprofen works incredibly well to reduce the microglia cells, which are the brain cells involved in this inflammatory response. And sometimes when a parent calls me and I'm going to have another conversation with them and, the next week, or I'm going to have them bring their child in, I say, okay, between now and the time I actually have our appointment, do ibuprofen with, lots of food and, I have gut protection, but around the clock for whatever, 3 days, 5 days, and let me know if you see a change. In PANDAS children, it can be absolutely dramatic reduction of symptoms, only they can't obviously live on ibuprofen. So then I look at herbs to reduce inflammation, and I also look at helping the body to detoxify some of the just the inflammatory proteins using lymphatic support and nervous system drainage, good fats, phospholipids, either while we're waiting for the labs to come back, or while we're waiting to figure out what the next steps are. I'm identifying and treating infections and doing everything I can to reduce the inflammation.
What are some of the herbs that are among your favorites for inflammation?
I love the Inflamaway by Natura. I just find it to be excellent. Well tolerated. It's cooling. I've never had anybody have a negative reaction, and that's something to say. And it has Japanese knotweed in there, which I think is neuroprotective. It has skullcap in there, which does help calm down that particular pathway, interleukin 17, and few other herbs in there. It's not a complex formula, and it can be taken similarly to ibuprofen. You can take 2, 3 times a day, or 2 twice a day, or 3 twice a day, and it tends to be extremely well handled. And I also really like the Cyflicom 2 drops by Beyond Balance. It's really made for nervous system inflammation, and it's in a glycerite base, so it's non-alcohol. It's easy for children to tolerate, and you can modulate the dose. Probably those are my 2 favorites, even though there's something called Advanced Inflammation Support by Complementary Prescriptions. It also is a very simple formula. It has nettles in there. It has Stephania. So, it really gets into the connective tissue. And nettles is also interleukin 17 modulating. So it gets the PANDAS inflammatory pathway. And I also see that work very well, and especially if a child also has Lyme.
Yeah, those are fantastic. Fantastic choices there. So let's talk a little bit about steroids. So we know that in these kids, there's a lot of potential infections that are in play. So we know that steroids maybe isn't an ideal thing to do, but are there some kids where steroids really are necessary to really kind of calm down either the initial presentation or a subsequent flare?
Absolutely. And, of all my treatment principles, my number one in children with PANDAS is to protect their brain first.
Makes sense.
And So it encourages me and even compels me to do certain things that I would be otherwise uncomfortable doing, or I'd be uncomfortable but less likely to do, because who wants to put somebody on steroids? Who wants to put a kid on antibiotics, for heaven's sake? You know, my child was not on any antibiotics till he was almost 14 years old when we figured out it was PANDAS, and I tried the strep nosodes and nothing else worked but the Zithromax, you know, and I was terrified putting him on Zithromax. I would never think I'd be shoveling these kinds of medications into children. You know, I come from a food as medicine background, but sometimes you have to save a child's brain by using steroids. And the way that I use steroids is very respectfully. If it's at all possible, I wait until the testing is back, so I can at least see if there's babesia or Lyme or something like that, because I feel like if a child really, really has PANDAS, right, which, see, if it's the babesia causing the symptoms, the prednisone's not going to work on that. The prednisone only works when the brain is on fire, and that's what's causing the symptoms.
That makes a lot of sense, yeah. And then by the time you know what microbes are in play, then there's less of a risk from the steroids, because you're also then able to kind of
treat them,
manage the microbial overgrowths.
Absolutely. And it's not like they're on steroids for a really long time. You know, I might do a 5-day burst in somebody that I either don't know the rest of their status yet, but it's pretty urgent, like they haven't eaten and they're going to starve to death, or they're going to jump off a roof, or, you know, run into the street. I mean, you have to protect the child's life and brain first. You know, I can always treat babesia, you know, but if there's brain damage, what are you going to do?
Yeah, absolutely. That makes total sense. What about the role of low-dose naltrexone in these kids? Is that something that you've also found beneficial?
About half the time.
Okay. And I'd say that's probably true in adults too. It's about half the time it seems to really help.
What I think about that in terms of PANDAS kids anyway is that low-dose naltrexone will modulate Th1 and Th2 responses, right? And so if there's a lot of that in play, then you're going to see more response. PANDAS specific is driven by this other response, which is Th17. And LDN does not impact that pathway at all.
Very, very good. That's helpful. So what are some of the tools then that you use to modulate the immune response and bring that autoimmune cycle to closure?
Well, if it's PANDAS, I sure like IVIG. You know, I have used a lot of different things. I've used a lot of different herbals, the LDN, herbals that are supposedly immune modulating, that may work in many, many ways, but I don't see the same response as I see with IVIG when it's really PANDAS. And so that just really, hands down, despite my best efforts, you know, to the contrary, as an integrated provider with a big toolkit, it's hands down my preferred path whenever that's possible. And sometimes, you know, kids just get better without it. You know, identify and treat infections, get them on a really good diet, take the gluten out if that's a problem, clean up the other bugs, get them with lots and lots of good fats and phospholipids to stabilize their cell membranes, you know, and then a lot of times they're just going to do great even without it. But going forward, I don't know if they're going to get the same complete brain healing. They may or may not. And I know plenty of kids out there that are doing fine without IVIG. But in 5 years, I don't know if they'll do as well as the kids that had IVIG. And PANDAS Network has been tracking still the first 50 cases that, were reported and they presented, back in 2010. And they have an agreement. The parents have been great to call the head of PANDAS Network, Diana Pullman, whenever their child flares, and continues to flare to this day. And a couple of years ago, it was very, very obvious that for the most part, with the minimal exceptions, the kids that continued to flare going forward were kids that did not have IVIG at the time, even though they were doing so much better at the time. And it's not 100%, but it's close.
That's very, very interesting. Tell us a little bit. The other thing that I hear a lot is plasmapheresis, to essentially pull out a lot of those antibodies that then are affecting the brain, for example. Is plasmapheresis a significant tool, or is it something that with all the other things that you do that you don't use very often?
A couple things about that. Plasmapheresis can be effective in removing the misdirected immune response, but it doesn't do, or the antibodies that are causing it, but it doesn't do anything to reboot the immune system. And thousands and thousands of people every day around the world use IVIG to repair autoimmune illness. It is not a stretch. It's a huge business, actually. And I would bet you 10,000 people get IVIG every single day. And they either get it for, a weak immune response, or they get it for an autoimmune illness. So taking the antibodies out with the plasmapheresis, I think you still are going to need IVIG. So you might have a more rapid recovery initially, but you're still going to run into the same problem later.
If only we could get IVIG cost-wise down to a more affordable level. That seems to be the challenge for a lot of people. It's still so expensive.
I know. And believe me, it's a huge enterprise and business. There are a lot of hands actually in that pot. But I'll tell you, I am getting more IVIG coverage for PANDAS than I ever have.
Wow.
And it's still not anywhere near I want it to be, but it's shocking to me that kids are getting covered.
That's great. Yeah, that's fantastic.
In Illinois, they passed a law in May mandating that all the insurance providers in the state of Illinois cover IVIG for PANDAS.
Wow.
And it's just going to be a matter of time. I know.
Wow, that's fantastic.
Huge.
So one of the things in the PANDAS realm that I've had several people contact me about was LDI, and they had some pretty phenomenal shifts in their children when they did LDI for strep, and that's the low-dose immunotherapy. Ty Vincent was on the podcast a few weeks ago, and so I'm curious, is that something that you've explored? Are you hearing similar positive comments about that?
I actually would love to explore it more specifically. I have a number of kids in my practice that LDI went wrong.
Okay. Yeah.
So I'm just a little bit afraid of it. That's the only thing. I think that there are lots and lots of kids, and maybe even most kids, that would do really well with it. It's just that you can't identify maybe ahead of time the kids that don't, and the ones that don't have a lot of trouble coming back from the reactivity of that. So that's the only problem.
How about homeopathy in terms of no-sodes for strep and other things? I know you mentioned it didn't seem to work so well for your son, but does that seem to work well for some kids?
Yes, there are some kids that I think that they never even come into, the mainstream system. There are some homeopathy people who are great at treating it. I don't know. It's actually a really good question, because we don't know the scope of everybody that's being treated. But I know, like, as a PANDAS parent and a provider, I have kind of this dual citizenship, right? So, I have access to the parent blogs and the Facebook groups, and then I have my other foot in this professional world where I see all kinds of things outside of it. And I hear all kinds of things. I have kids that homeopathy works. I have kids that homeopathy doesn't work. I was just randomly, looking on one of the bigger parent Facebook groups this morning, every now and then if I have a minute to answer a question or, whatever. And it was just this one interesting question a parent asked, and then all these other parents kind of get on and try to give information, and every possible thing was on there. Yes, do it. It worked for me. Oh, that made everything worse. Oh, do it if it works. Oh, try this instead, or do it at this dose, or oh, that made my kid crazy. So
right.
Everybody is different.
So if the original trigger was strep, it seems like that's such a common exposure for kids, especially if they're still in a school environment. So once you get a child back to a good place, do they often need to do some type of prophylactic antibiotics to minimize having another flare? Is that a common thing that has to be done?
Yes, it is. And, PANDAS as a subgroup, pure PANDAS, like someone who's really, really reacting to strep, it's rheumatic fever. So if somebody gets rheumatic fever, that means that every time, so rheumatic heart disease, which is the most commonly understood example, every time that child gets strep moving forward, they're going to make antibodies that destroy their heart. That's what's going to happen. And so, of course, they're going to be on some kind of prophylaxis, at least through their childhood, because as we mature, we do tend to not be susceptible to strep so much. And so CDC has, rheumatic fever prophylactic protocols that people around the world follow for kids with rheumatic fever. I have plenty of kids that are off antibiotics like through the summer. And then when school starts, maybe even just twice a week Zithromax. And I also use some herbs, for example, the IMNB, which is made for strep through Beyond Balance. But I've had kids get strep being on only IMNB. So, I like to do some kind of a combined approach. But yeah, it's not good for them to get strep again.
I know that diet and nutrition is one of your passions. I've been to some of your lectures on that topic before, which were wonderful. So I'm curious if leaky gut, the microbiome, if those play a role here, and then what types of dietary recommendations do you generally give to your kids that have PANDAS or PANS?
The majority of kids that I see do have significant gut issues. Not 100%, but a good chunk of them. And, there's that saying that says leaky gut, leaky blood-brain barrier. The gut and the brain, the gut-brain axis is a very real thing. And you can look that up in PubMed, and thousands of articles are going to come up about the gut-brain axis, inflammation in the gut, impacting inflammation in the brain, the microbial balance in the gut, interacting with the nervous system in a way that modulates how much serotonin is made, how much GABA is made. It is so primal, that whole issue. Plus, there are certain basic things, like if somebody has a true gluten autoimmunity that's affecting their gut, and I happen to find a much higher percent of children with PANDAS do have that problem than regular population, much higher percent, at least 50% have autoimmune gut or brain response to gluten in my practice when I test. But that is a Th17 problem. It's the exact same pathway that ends up producing that cytokine called interleukin 17. The gluten antibodies produce that, and it's that same cytokine that breaks the blood-brain barrier in pandas. And so there can be some of these, preconditions that allow for the breaking of the blood-brain barrier kinds of things that you see in pandas. Plus, a lot of kids have strep in their gut. I've seen strep, perianal strep or even vaginal strep in little children. So it comes out negative in the throat or even in the nose, but it's in other places. So doing all that testing and cleaning that up is so, so important.
Wow, that's very helpful. We talked a little bit about autism, and I think some people tend to think that PANDAS, that there is a lot of overlap with autism, others not. I'm just curious, what is the overlap between PANDAS and kids on the autism spectrum, or is there one?
It's probably fairly complex, but there's not a given overlap. Kids with PANDAS do not all have autism, and kids with autism do not all have PANDAS. However, I think there's probably a greater percent of kids on the autism spectrum that do end up with PANDAS. And I think the reason is they already have blood-brain barrier issues. They already have cell membrane issues. And some maybe unknowable heretofore yet, unnamed, right? Misdirected immune response. They may have brain inflammation, right? So I think they may be more prone to getting PANDAS because, any given year, a really bad strain of strep comes through, just like a bad flu, right? In any given year. And the flu that comes through this year isn't exactly like the flu last year or the year before. We all know that. And it's true with strep too. And there might be a higher virulence or more rheumatic strain of strep that comes through, this winter than last year. And it's going to infect everybody the same. So some kids are going to get strep, some kids aren't going to get strep, but some percent of kids that are susceptible to PANDAS are going to go on and get PANDAS because it's going to be that type of strain of strep that will do it. So it's going to be somebody that already has some implication regarding their immune response or their blood-brain barrier or cell membrane disruption. So that's why I think more kids are prone to it.
That makes a lot of sense. I know that you played a big role in making the documentary My Kid Is Not Crazy happen. I saw it. I found it to be very, very powerful. I think it's important that the film and other things like it are out there to really bring awareness to this condition because it has such a significant impact on the lives of the kids and the families that are dealing with it. Wondering if you could just tell us a little bit about the film and how people can find the film.
Well, they can find the film by going to mykidisnotcrazy.com. And there's a link there. You can watch it online through Vimeo. It's very, very simple. I think it's $3.99. Or you can order the DVD, and it has a lot of extras on there too. So the only thing is it's only for Blu-ray right now, the DVD release. So not everybody can watch that. But it is a powerful look into the lives of families that are dealing with their children having PANDAS, and a dialogue of a couple of dozen providers that are treating it or trying to treat it or researching it or don't believe in it. And so it's kind of like an expose looking at legislative and pharmaceutical and insurance issues and professional banter. All the while, these poor kids are just trying to get treated. And there's a range of success in terms of the kids being treated, and nobody knew going in how that was going to turn out. Right? Like, are these kids going to get better? Or are these kids not going to? Are they going to flare? Are they going to get worse, going in? So, and it's kind of reflective of what you see. There's this one young lady who's a beautiful, very eloquent, sweet, in her early 20s young lady. And she may or may never be totally better of PANDAS because she was misdiagnosed for just so long. There's another, young man also who is misdiagnosed for so long, that he may never fully recover. But then there's wonderful recovery too in other kids. And I think it's very reflective of, what we're seeing out here. And the film is powerful because that all happens inside of this other dialogue about whether or not you can treat PANDAS, whether it exists, whether insurance will cover it. And then there's just these people trying to treat their children.
I thought it was fantastic. I thought it was a lot like 10 years ago in the Lyme arena, we had the film Under Our Skin, which really shifted Lyme awareness. I mean, there were so many things that happened as a result of that movie, and I kind of feel the same about this one, that it's just it's gonna bring so much awareness and so much needed attention to this condition, hopefully get more people working on research and other things. So I really urge people to go and watch it. I found it deeply, deeply touching and moving. It's powerful. What are some of the most important things that you do in support of your own health on a regular basis?
I probably have a few things that I really, really try to do most of the time. Number one is phospholipids. To the max of my budget, I consume phospholipids.
And you're doing those orally, or are you doing IVs? How are you, both?
I'm doing them orally right now. I've done some IVs, but you can get a tremendous amount of benefit just orally. And I think it is so strengthening for the structural foundation of our bodies on every level, from the cell membrane, the mitochondrial membrane, the nerve sheath, and the brain tissue itself. So I find I'm a better person on phospholipids.
I agree, and I take them every day too, so we're on the same page about that.
Right? I know. Yeah. And I think for the most part, if I do that, if I really drink enough water and, get enough exercise and juice at least a few times a week, I'm going to be doing great. Those are like my real core things, aside from not eat too much sugar and, stuff like that. But those are my main things. And probably, B12 that I take almost every day.
Fantastic. So people listening, how can they find you if they're interested in working with you as a practitioner or learning more about PANDAS and PANS?
Well, if you want to learn more about PANDAS and PANS, the best thing is to go to the pandasnetwork.org website. They have every bit of information, links to any resources that you need, a great database, letters to send to your child's school, assessment tools, and all links to all the research articles. So they're wonderful. You can also contact them if you need support or have a specific question or want to find a provider in your area. And then if you want to talk to me, you can go to my website, which is amyjoysmithnp.com.
Fantastic. This has been a great discussion. I suspect already that it will be one of the more popular podcasts because people are always looking for information about this topic. Whenever I share something about PANDAS and PANS, it's one of the things that gets a lot of interaction with people. I certainly appreciate you spending time with us today, but I appreciate your passion. I appreciate what you do for kids. I know this has been a difficult journey for you and your family, but I think you really turned it into something meaningful meaningful and beautiful by helping so many others. So thank you for being you and for doing what you do.
Thank you. Thank you. And thank you for doing what you do. People love to use your website, your information as like a real person, thoughtful resource. And I think so many people are grateful to you for turning your journey into a contribution as well.
Thank you so much. For more information on today's guest, visit amyjoysmithnp.com. That's Amy Joy Smith, NP, as in Nurse Practitioner.com. To learn more about the PANDAS documentary, visit mykidisnotcrazy.com. That's mykidisnotcrazy.com. I appreciate your support of the Better Health Guy blogcasts series. If you'd like to follow me, you can find me on Facebook and Twitter as Better Health Guy. The show can be found on YouTube, iTunes, Google Play, and Stitcher. If you'd like to support the show, please visit betterhealthguy.com/donate. And if you'd like to be added to my newsletter, please visit betterhealthguy.com/newsletters. I'm looking forward to many more shows ahead and appreciate your interest.
Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.